Nearly 1.75 million fewer children were enrolled in Medicaid this year compared to last year. And as an economist who studies how we pay for healthcare, I want to talk about the causes and the downstream ramifications of this. Because even if you or your children are not enrolled in Medicaid, if you use any sort of healthcare services, you will be feeling the impact. Now, there are several reasons why economists think enrollment this year is a lot less for children compared to last year, a lot of which has to do with the impact of the nearly $1 trillion cuts to Medicaid that were passed in the One Big Beautiful Bill. Part of this is a misconception about the income requirements needed to enroll in Medicaid. The income requirements for children for both Medicaid and the Children's Health Insurance Program are at higher thresholds compared to adults. So if a child's parents are looking at the income requirements and they don't understand that the income thresholds are different, they might think that their children don't qualify for Medicaid when they actually do. There also seems to be a lot of confusion and misinformation surrounding the work requirements rules that Congress passed last year in the One Big Beautiful Bill. These work requirements rules stipulate that individuals to qualify for Medicaid must work at least 80 hours a month or go to school or volunteer. But notably, children, do not need to meet these work requirements. However, it seems like a lot of parents are confused about this and might be less likely to enroll their children in Medicaid. It's also important to note that federal law dictates that once a child is enrolled in Medicaid or CHIP, they must maintain continuous enrollment through the next calendar year, right? They can't lose their health insurance in the middle of the year with which they're enrolled. And there have been several instances in states, most notably Florida, where tens of thousands of children have been kicked off of Medicaid because their parents allegedly are not paying their Medicaid healthcare premiums. Now, this case is currently going through federal court right now, so we don't know what will change about the enrollment of these children in Medicaid. However, what we do know is that these children who don't really have control over paying their healthcare premiums, it's their parents or their guardians or whatever, are being disenrolled and removed from their health insurance. With this many fewer children not enrolled in Medicaid, what are the potential implications of this, both for those children as well as for everyone else? We know, looking at historic trends, that when children are removed from Medicaid, right, when they no longer receive it, they tend to go uninsured, right? They're not enrolling in private health insurance or other health insurance programs. When children don't have health insurance, right, when they are disenrolled from their health insurance, number one, there's greater financial instability for those families because they are having to pay for any health care that they need out of pocket. And number two, you are putting children's health and development at risk because families might not be so inclined to go and seek out preventative care services or ambulatory services for children and might only seek out healthcare in emergencies. We also know from economic studies that children who are enrolled in Medicaid are more likely to graduate from high school and college, more likely to have higher wages, and subsequently more likely to pay more in taxes. And so by disenrolling in Medicaid, we have a very short-sighted view of what these policies can actually do. You might be saving a couple million or $1 billion by disenrolling all of these children, but you are harming the potential economic benefit of these children when they have access to stable health care in the long run. We also know that when you disenroll children from Medicaid or CHIP, it actually ends up increasing healthcare costs overall, right? Not just for those children specifically, but across the entire community. And the reason is because when you have children who are disenrolled, they tend not to get primary care, they tend not to get preventative care, and they can get really, really sick. And this means that you shift care from the ambulatory setting to something like an emergency department or a hospital where you are going to have an increase in healthcare costs. And you know what? The more I learn about the US healthcare system, because even though I have a PhD in economics and I study health economics, I'm always learning more and more about the US healthcare system along with you, the more I realize that healthcare needs to be a community-focused thing, right? We need to think about healthcare and the health of the community as benefiting the entire community and society. And unfortunately, in the US, we tend to live in a more individualistic system. And we're ultimately having to make a choice, right? And it seems like currently the popular choice among certain people is to save a buck here and not even think about the future, not even care about the future ramifications down the road. And it's a little sad if you are thinking about this more in a long-term view. But for now, that's all I got. And as always, if you have any questions, let me know.